Yes.
Okay.
So I'm going to say hello, and everybody's joining now for season 5, episode 3 of Gateway Center of Excellence in Rural Health's virtual lecture series. So we're going to start real soon. So hello, everybody. Today's date is October 17th, 2024, and the topic for today's lecture is Immigrant Healthcare, Understanding and Addressing Barriers. My name is Sage Milne, and I'm a research assistant at Gateway Center of Excellence in Rural Health, an organization that aims to better the health and quality of life of rural residents through research, education, and communication. This lecture is a collaboration between us and the Huron County Immigration Partnership, which we're really happy to be involved with. Today's presentation focuses on immigrants and newcomers to Canada. This group faces unique challenges in accessing healthcare in rural areas. So Huron County, where we're based, is home to 4,200 immigrants and 1,300 temporary international workers, making up about 8% of the population. A survey of immigrants and newcomers to Canada who live in Huron and Perth counties was conducted in 2023. And in that survey, 33% said that the biggest challenge they faced in this past year was finding a family doctor or other appropriate healthcare. So in response to these statistics, the Huron Immigration Partnership and Gateway have developed today's lecture. Before this lecture starts in full, I want to acknowledge that the Gateway office resides on the traditional territory of the Anishinaabe, Haudenosaunee, Neutral, and Wendat peoples. Turtle Island, North America, is home to many different peoples. And as we talk about immigrant healthcare, there are lots of shared experiences of problems with accessing healthcare services between both migrant and Indigenous populations due to geography, language barriers, and social exclusion. We all come from somewhere, and within this educational series, we hope to promote social inclusion and understanding to better health for all. So it's our pleasure to welcome a wonderful presenter to lead this discussion on healthcare for immigrants in rural communities. Dr. Saleema Allana is an assistant professor from the University of Western Ontario. Her program of research explores disparities in immigrants' health and well-being. She explores immigrants' cardiovascular health, aging, brain health, health systems preparedness to accommodate immigrants' health needs, and immigrant settlement in Canada. She's recently looked at telehealth as well. We're also welcoming Mark Nonkes. He's the Immigration Partnership Manager for Huron County, and prior to joining the County of Huron, Mark worked at newspapers in southwestern Ontario, an international development agency in Kenya and Laos, and a human rights organization in Namibia. He holds a Master's of Arts from Wilfrid Laurier University and a Master's of Library Science from the University of Western Ontario. To thank those that are ongoing attendees, we offer certificates at the end of each semester to those with perfect attendance to recognize your commitment to and involvement with this educationist series. So throughout this lecture, we encourage you to ask questions of the panelists and lecturer. Add your questions to the chat box just below and they will be addressed. A brief disclaimer, the views expressed in this lecture may not necessarily reflect Gateway's point of view, but we believe in providing a platform for a range of perspectives and thoughtful discussion. And now I will hand it over to Dr. Saleema Allana, who will continue on with her presentation.
Thank you, Sage, for this wonderful introduction. I will share my screen. Okay, is my screen visible? Okay, thank you. Okay, so as Sage has already introduced me, I'll just briefly talk a bit about my program of research. I am an immigrant health researcher, and as Sage has identified some of the areas of my program of research, I research around immigrants' cardiovascular health, their aging, their brain health, and also their access to the healthcare system within Canada. And a big part of it is how inclusive the healthcare system is for the immigrants to accommodate their health needs. And so a part of my program of research also looks at the equity, diversity, and inclusion policies within the healthcare system and how are those translated into practice to make the healthcare system more inclusive for immigrant populations. So this is the kind of work that I do. And so as part of the today's webinar, you'll hear a lot more about my research and, what are some of the important things that we are looking at in terms of immigrant health. But before I delve into all of that, the first most important thing to understand is that why immigrants are a unique population and why do they have unique healthcare needs. And so there are a number of factors that really make immigrant populations unique. So for example, their health values, beliefs, and practices. Now, most of these immigrants come from different parts of the world, and then they carry different cultures. And so different cultural values, beliefs, and practices when it comes to their health. And these health values, beliefs, and practices really affect the way they maintain their health. And therefore, as healthcare professionals and as researchers, it is really important for us to understand the unique values, beliefs, and practices that the different groups of immigrants come in with. Because unless we understand these values, beliefs, and practices, we won't be able to help them maintain an optimum level of health. So that's one thing that really makes them a unique population. The other important thing is health literacy. Many a times, in some of the immigrant groups, you would see a lower level of health literacy. And that's because, they are coming from a part of the world where health literacy probably wasn't that prevalent. And so, having lower levels of health literacy puts them at risk of various health issues and not being able to maintain their health at an adequate level. And so therefore, this is a population that is at risk and needs to be dealt with, with a unique approach, considering their unique health values, beliefs, and practices, and their levels of health literacy so that we can contribute towards better health among immigrant populations. The other factor that makes this population really unique is an unfamiliarity with the Canadian healthcare system. Now, this is quite obvious. Somebody coming from other part of the world, where the healthcare system was completely different than how it is in Canada. I mean, of course, they are not that familiar with the Canadian healthcare system in the beginning. And so because of that unfamiliarity, many a times they are not sure what are the entry points within the healthcare system, maybe how to get a referral, how to, get to a family doctor, how to approach a specialist for care. And so all of these the unfamiliarity actually leads to an added layer of barriers for the immigrant populations to access the healthcare system. And then the last factor that really makes them unique is the language barrier. And so, because of the language barrier, many a times immigrants are not able to communicate their needs effectively to the healthcare providers. Neither they are able to understand the healthcare provider's perspective on their health. And so, as healthcare professionals, it is really important that we understand all of these unique characteristics of the immigrant populations and then provide them care accordingly. These are some of the barriers for immigrants in healthcare, which are very important to be understood by the healthcare professionals because unless you understand these, you won't be able to provide them the contextually and culturally appropriate care that they need. So the first set of barriers is really the access barriers that they have in terms of accessing the healthcare system. And so, for example, the inability to have a family physician is really something, it is a big access barrier. Now, I understand that that's something that exists Canada-wide for all of the populations, but immigrant populations particularly are affected by this because when they are new to Canada, they are really looking for a family physician. However, most family physicians are already overbooked, and so, they rarely get a chance to have a family physician. The other access barriers include appointment delays with the doctors or for healthcare services, increased wait times, and all of these really, um, create barriers for accessing healthcare among immigrant populations. The other set of barriers, so I've actually divided the barriers as per the different levels of cares or as per the different healthcare settings that we have in Canada. So to start with primary care, I think the biggest barrier in primary care is really the inability to have a family physician. And as Sage also, when she was describing the survey results from the Huron County, that came up as one of the biggest access barrier in the survey as well. And it remains true for immigrants all over Canada, that they, the biggest barrier for them in accessing primary care is an inability to have a family physician. When it comes to secondary care or secondary prevention, so, for example, cardiac rehabilitation programs are meant for secondary prevention of cardiovascular disease, cardiovascular acute events. However, when you look at the attendance at cardiac rehabilitation programs across Canada, you will see that, there's a very small number, a very, very small number of immigrant populations you would find enrolled in those programs. There could be a number of factors, but, based on the research that I have read and done so far, what I have realized is that many of these disease management programs, these secondary prevention programs, are geared towards the general population, and they mostly lack the cultural and the contextual relevance for the immigrant populations. And so when these populations, when the immigrants feel that these programs are not able to fulfill their unique needs or their unique requirements, then they tend not to attend such programs. Similarly, in the tertiary care hospitals, when it comes to specialist care, my observation has been, as part of our research, when we try and recruit immigrant populations from tertiary care hospitals, it becomes really difficult because there are very few immigrant patients who would present at the tertiary care hospitals for specialist care. Now, again, that's a big issue because, if they are more at risk of chronic conditions and, that need to be treated via specialist care, and these populations are not presenting at the tertiary care settings, then that's a huge, huge issue. And I think, again, we need to do a lot better on making our healthcare inclusive for immigrant communities, for them to come forward and present at these hospitals, these tertiary care settings as well. When it comes to community agencies, it seems that immigrant populations are more comfortable going there because those are more accessible in terms of distance, in terms of transportation, but then the barrier there is that the community agencies need to be and the healthcare professionals working there need to be trained more effectively around the healthcare needs of immigrant populations, so then they can provide more effective, culturally and contextually relevant care to immigrants. And so as I use the term inclusive healthcare or equitable healthcare, that's the goal. That's the goal that we need to move towards. And in order to have equitable healthcare or inclusive healthcare for immigrant populations, we need to tackle with some of these barriers that I already talked about, and some of the other barriers that we need to tackle or that we need to work on are, for example, language and cultural barriers. So many a times when you talk to immigrant populations, they would say that, we really need effective translation services within the healthcare settings so that we are able to communicate our views to the healthcare professionals, and similarly we are also able to understand what they are advising us. And so one way to have inclusive healthcare is really have effective translation services within our healthcare centers settings, because as I discussed before, many of the immigrants are unfamiliar with the Canadian healthcare system. So making them more aware about the various healthcare facilities that we have, what are the different point of entries into the healthcare system, how does the referral system work, how do they get to a specialist care at a tertiary care setting. So spreading all of that awareness among the immigrant populations is really very important to achieve the goal of inclusive and equitable healthcare. And then lastly, racial discrimination is a big, big barrier within the healthcare system that that hinders the access to and utilization of healthcare among immigrant communities. And so the goal is to eliminate racial discrimination from our healthcare system, and we all need to play our part in eliminating racial discrimination. So our healthcare professionals need to be trained widely around equity, diversity, inclusion principles. The leadership at the hospitals need to be invested into eliminating racial discrimination. And that's when we are going to achieve this goal of equitable healthcare for immigrants. Okay, so these are some of the key immigrant health issues that I research around. And so looking at the research that's already out there and the research that I do, I believe that these are some of the big issues within the immigrant communities. And so that's why I have picked those up for my program of research as well. So for example, chronic conditions, immigrants do have a large prevalence of chronic conditions, including cardiovascular conditions and other, hypertension, diabetes, and other chronic conditions. And also because chronic conditions need to be self-managed a lot of times, and there's a whole lot of family caregiving component to it. The self-management component and the family caregiving component differs largely among the immigrant populations as compared to the general population. And so when we are dealing with immigrants with chronic conditions, some of the important areas to consider are how well are they self-managing their condition? How can we as healthcare professionals help them improve their self-management and the family caregiving? Aging is another big thing. I mean, healthy aging and of course, aging with different diseases and disabilities is an issue among immigrant communities that needs to be researched more upon and that needs to be dealt with culturally and contextually relevant care by the healthcare professionals. Brain health, when it comes to dementia, Alzheimer's, immigrant populations have unique risk factors. They're more at risk. And so again, there needs to be more concentration on, preventing them earlier in life to get into preventing them from dementia and Alzheimer's disease. And if they have gotten it, then, providing relevant care to these populations. As I said before, caregiving is really different in immigrant populations. There is a focus on aging in place. There's a focus on family caregiving as part of many cultures that immigrants represent. And so looking at their unique caregiving needs, we as healthcare professionals need to work with them to improve their caregiving experiences. Virtual health is another important area when it comes to immigrant health because, of course, virtual health is now taking over rapidly in Canada, many a times due to decreased levels of digital literacy or due to issues around access to digital care or virtual health. Immigrants lag behind in this area. And so, we need to work with them to improve their proficiency in, using virtual health more often. And then the last bit is that around equitable healthcare services, which is an issue for all of the vulnerable groups here in Canada. As Sage mentioned, around Indigenous populations, we have, gender diverse populations as well, women, and then immigrant populations. So all of these populations, need equitable healthcare services. And we as healthcare providers can play a huge role in making healthcare services more inclusive and equitable for them. So in the later slides, I'll talk about a few of my projects as an exemplar here that have looked at immigrant health and what specifically we are exploring as part of those projects that I'll be talking about next. So the first project that I'm describing here is a scoping review that we carried out around caregiving for heart failure patients among racialized communities or immigrant communities. This scoping review is now completed, and we did it to map the existing body of literature around caregiving among racialized heart failure patients. These are some of the important findings that I have listed here that came out of the scoping review. So the first one being the importance of social support for informal caregivers. Now, in many of the studies, the family caregivers who were from the immigrant communities, they described how important it is for them to receive social support as part of social groups that might be going through the same experience. So many of these caregivers had higher levels of caregiver burden. Their quality of life they described their quality of life being decreased due to being increasingly involved into caregiving related tasks. And so they really needed good social support to get them going in their lives and to get them going in performing their role as family caregivers. Now, I think this is a huge finding for us as healthcare providers because many a times we focus on the needs of the patients, whereas the informal or the family caregivers are many a times forgotten. And so this is an important population when it comes to immigrant populations to look at. A lack of knowledge and the effectiveness of educational interventions. This is, again, the caregivers voiced their concern that, many a times they lack knowledge around how to effectively care for the patients. And these were all, immigrant or racialized caregivers. And then they also said that, they found the educational interventions really effective whenever those were provided to them. So again, I think one thing for us to consider is provision of relevant educational interventions for these caregivers so as to make them more capable of caring for the patients. Caregivers' perception of a life interrupted. Now, we already know that, caregiving is a huge task, has a lot of caregiver burden associated with it, but especially for the patients, caregivers from the immigrant communities. I mean, they were going through financial issues as well. Sometimes they had to quit their job to assume their caregiving responsibilities. And so, it was really tough for them. Navigating the healthcare system from the perspective of heart failure patients and caregivers. Uh, as part of the findings, it came up that caregivers many a times voiced their concerns around that they felt unheard within the healthcare system. When they talked to the healthcare providers, they felt that their concerns were unheard, their questions were unanswered many a times, and they were not provided the right information. And so again, that comes on to us as healthcare professionals to meet the needs of this group of caregivers. Caregiver quality of life was certainly affected, and caregiver burden was something that really came out as part of the findings. Another important finding was the role of religion and spirituality, culture, and ethnicity in patients and caregivers navigating heart failure. This came out in a few immigrant groups like African American, South Asian, and a few other immigrant groups, whereby they said that, if they had good spiritual support, support from the people from the same culture and ethnicity, that really, supported them well while they were navigating through their caregiving role. And then the last finding was around the financial concern. As I mentioned before, many of the caregivers had to quit their jobs to assume their caregiving responsibilities. The other project that we are involved with currently is around the immigrants' use of virtual care. And what we are doing therein is co-creating the principles of compassionate virtual care for South Asian immigrants, a patient and community partnered research project. And the reason why I pursued this project was because, we are all aware about the health inequities that exist in immigrants' use of virtual care. As I said before, these could be due to a lack of access to technology. This could be due to a decreased level of digital health literacy, and maybe personal beliefs about technology. Now, virtual care is really booming here in North America and Canada, especially after the pandemic. And, of course, patients have to utilize virtual care many a times for their appointments. Now, however, the ethnic minorities have faced significant barriers in utilizing virtual care. And many of the papers that were published amidst the pandemic and after, they really talk about these barriers in accessing virtual care. So for us, what was important was that we developed the principles of compassionate, equitable virtual care for immigrants. And so for this particular project, we are working with South Asian immigrants in particular. As I said before, each immigrant group is very different in their approach, in their healthcare values, beliefs, and practices. And so we really need to work with each of those groups individually. So we picked up South Asian immigrant community for this particular project, and we are exploring the meaning of compassion, equity, trust, and a productive patient-provider relationship for South Asian immigrants in the context of virtual care. So what makes virtual care more compassionate, equitable, and trustworthy for them? And then we will use these understandings as the basis to co-create the principles of compassionate and equitable virtual care for South Asian immigrants. This project has been already funded by the AMS Healthcare, and this is already, in progress. I'll be happy to share the findings once we are, done with the project and we have the findings on hand. The third project that I would like to discuss is around the equity, diversity, inclusion policies and initiatives in the Canadian healthcare settings. So basically, the healthcare settings today, have prioritized equity, diversity, inclusion, and decolonization to reduce or eliminate the barriers, the healthcare disparities that we just discussed before, that almost all of the vulnerable populations encounter, including the immigrant populations. Now, although we do have these EDI policies on paper, however, there's an obvious lack of translation of these policies into practice within the Canadian healthcare system, which certainly leads to disproportionate health outcomes for all of the equity deserving groups, including immigrant populations. And so what we are planning to do currently is to develop a nationally owned and publicly shared research agenda around translating equity, diversity, inclusion policies into practice in the Canadian healthcare system, and to develop a network of interdisciplinary researchers and long-term partnerships with the relevant stakeholders in this field so that we can all come together and ensure the translation of EDI policies into practice in the healthcare system. We are also planning to undertake an environmental scan of the existing EDI policies and initiatives in the Canadian hospitals. And for both of these projects, currently we have applied for funding. And then as soon as we get the funding, we'll get going. So that was all for the lecture today. But so I just wanted to take a few minutes at the end to share a few key takeaway messages for those of you who are attending today's webinar. So, as we have seen throughout the presentations that there are barriers related to healthcare access and utilization for immigrants in Canada, which need to be addressed. Some of these important barriers include language and cultural barriers, unfamiliarity with the healthcare system, racial discrimination, and many others that we discussed throughout. These barriers need to be tackled at the level of primary, secondary, and tertiary care, as well as in community agencies. And the most important thing is that all of us as healthcare professionals and as researchers can play a very important part in making healthcare more inclusive and more equitable for immigrant populations. And the last thing is that research is the powerful tool that can be used to explore these solutions, and then we can translate those into practice, again, with the goal of making healthcare more equitable for immigrant populations. These are some of the references, and I would appreciate if you go through these at your own time. These are really good reads with relation to immigrant healthcare barriers and solutions. With that, I would like to thank you everyone who came today to listen to this presentation, and I would appreciate any questions. Thank you so much.
Thank you so much, Dr. Saleema. We're going to ask that Mark share a little bit about on-the-ground activities in regards to immigrant healthcare and what we can do to help promote well-being of immigrant populations.
Thanks so much. I think I need to stick to well-being because my knowledge of the healthcare setting is not as extensive as Dr. Allana's, and I really appreciate the presentation she gave and shared with us. So we'll stick to well-being today, but I did want to just respond to some of the information that was shared and provide a local context to that. Are you able to see my screen?
Yes.
Great. Perfect. So one of the key things, maybe I should start by, I work for the Immigration Partnership. Immigration partnerships are across Canada, and our job is really to help make sure that newcomers' settlement experiences are strengthened. And we work with a number of different partners and different organizations to make sure that we're in this geographic region of Huron County, making sure that when people move here and they're new to Canada, they can succeed. And So we do that in a number of different ways. We coordinate meetings and we share information with people who are providing the services for immigrants. We help people build connections with one another. We have so we organize events or activities for immigrants. We host workshops and webinars to build knowledge with the aim of strengthening services and community response to immigration. We create and share information for immigrants and for organizations that work with immigrants, and we conduct research. And so I'm going to take a few minutes to talk a little bit more about the research that we work with and that we've done over the past couple of years and how it might tie into healthcare. So back in 2021, the Immigration Partnership worked with the University of Western Ontario, and we conducted research with people to find out their experiences of discrimination. And from that survey, we learned that 69% of immigrants and visible minorities in Huron and Perth who filled out our survey, and there were 595 people who did, had experienced some form of discrimination that they identified in the past 3 years. 81% of the Indigenous people who filled out our survey had experienced discrimination, along with 49% of white non-immigrants. We also investigated the places where discrimination frequently occurred. And far and away, the most frequent place that discrimination occurred was in workplaces. And I haven't captured that here, but there were also other spots that were identified. And one of them was healthcare settings. So people told us that in healthcare settings, 28% of immigrants and visible minorities had experienced discrimination, 52% of Indigenous people, and 21% of non-immigrants. So this certainly emphasizes Dr. Allana's point that discrimination is a concern, and it is one locally too. More recent research was conducted last year with the University of Guelph. We conducted a survey of immigrants across Huron Perth, and we want to learn about their experiences in our community. So we had 195 people fill out the survey. 105 of them were from Huron and 90 were from Perth. 65% had been in Canada for less than 5 years, and they came from 49 different countries across the country. We asked people, what was the biggest challenge your family faced in the last year in Huron and Perth counties? And so people actually could answer more than one thing. So you'll see that this doesn't all equate 100. The 47% said the cost of living was the biggest challenge that they face, followed by finding a family doctor, finding affordable housing, accessing transportation, and finding work that matches their professional qualifications. We had heard from other local immigration partnerships that access to interpretation support was a challenge within healthcare settings. So we actually asked a question on that survey about that topic. So we asked, if you or a family member went to a hospital, health clinic, or talked to a health professional in the past year, was in-person or phone video interpretation provided? So most of the people actually didn't need language interpretation. The people who filled out our survey, 56% did not. Another 13% never went to the hospital or clinic or a health professional in the past year. 9% said yes, translation or interpretation was provided. 8% said they brought a family member or a friend because interpretation was not available. 5% said they wanted language interpretation, but they did not receive it. And 4% said they brought a family member or a friend to interpret because that's what they wanted. They preferred that. We also asked people what suggestions they had to improve our community for the future and for future immigrants who move here. And so while these don't pertain directly to health, you'll see that they do influence social determinants of health. So 34% said they wanted better programs for immigrants to find work or start a business. 28% said availability of public transportation. 26% said more affordable housing. 23% said they wanted more actions to increase welcoming and acceptance of immigrants. And 23% said employers should be educated about hiring, retaining, and promoting immigrants. I think if I can just draw into the public transportation, anecdotally, we have heard that this is a significant challenge for people, especially when they want to access healthcare in our communities and they don't have a vehicle. So immigrants often will ask us for transportation assistance. And luckily, we work with a wonderful group that is volunteer-led that provide transportation to immigrants who are new to Canada to get to hospitals. So I'll tell you a bit more about that in a second. The Immigration Partnership got this vision, and we came up with a strategic plan late last year. It was influenced by academic literature, also by the research that we were conducting, and by a focus group of 40 people who either work directly with immigrants or immigrants themselves. So we came up with this vision that Huron County would be a welcoming community where newcomers feel supported at home and integrated into all spheres of life. And we had 4 focus areas that we are prioritizing. One is to increase and strengthen collaboration, so more people are working together to support immigrants as they move here. To strengthen capacity of the newcomer serving ecosystem by building a welcoming community that fosters meaningful connections and delivers information to people, and then to build understanding of immigrant needs, assets, and service gaps. I also want to just draw into this what many of us in the immigration partnership world focus on is what makes a welcoming community. And there's foundational documentation from Victoria Estes at the University of Western Ontario, who we've worked with, along with Hamilton, Aslam, and Barrows, and they're all leading immigration researchers from across Canada. They identified that there were 19 different characteristics of what makes a welcoming community. They did this by consulting the literature and talking to people who worked in the immigration service industry. And then they asked people from this 19 list what were the most important things that needed to be prioritized if communities want to be welcoming. So I'll read through the first 10 and maybe give you some insight on how we're working on that, and then we'll take a break for questions. So access to affordable, adequate, and suitable housing is key to have a welcoming community. If you don't have a place to live, you can't be here, or life is going to be very difficult for you. We're currently working on a new research project that is investigating newcomers' experiences of housing here in Perth, because there is really little information about immigrant experiences of housing in rural Canada. Employment and entrepreneurship opportunities. We've been working with an organization called Boreal College. They have somebody who has dedicated their time to providing employment assistance to immigrants, and that person's multilingual, and they come to both Goderich and Exeter on a regular basis, and they're also available for virtual consultations. We are working with the Small Business Center and Community Futures to ensure that newcomers have information on how to start a business in our community. Today's event around access to suitable healthcare, including mental health care, are important for a welcoming community, so that we become knowledgeable, and we hope to work more on this in the future. Positive attitudes towards immigrants of all racial, cultural, and religious backgrounds. That's important to have a welcoming community. And we do that through a number of different ways. we have the Multicultural Festival every year that we organize with a group of people. There's Welcoming Week, which was just held in September, which brought people together to meet one another and welcome new people to the community, whether it was at Meet Your Neighbor night at the library or film screening at the museum or other small events. They were great to build connections and help people understand and get to know one another. We also work with a settlement agency out of London who provides service to this area so that immigrants are helped settle properly and are referred to services, and there's somebody to walk alongside them. We make sure that there's more awareness of this organization, and we're constantly bringing people together so that they can strengthen awareness and reach more immigrants. And then finally, access to transportation. We worked with this group that I was mentioning before called the Huron Newcomer Support Association. And they provide transportation to newcomers. It arose out of the Ukrainians who were moving to the area, and it's kind of continued on since then. They provide rides to people to get to work, to get to medical appointments, and other essential appointments. That's been key because many of our communities are cut off from public transportation. So that certainly is providing a much needed service. Educational opportunities. We coordinate conversation circles at the libraries. We're working with various organizations that strengthen ESL or provide ESL training, and we make sure people know about them. Ongoing commitment to anti-racism and anti-oppression, that's the cornerstone of what we do. We have recently launched a guide, and it's an introduction to diversity, inclusion, and equity. And if you're interested, there's a webinar coming up on November 6th, I believe, to launch that publication. And then access to service for free French-speaking immigrants. That's again connecting with Boreal College. And we want to make sure that our municipal services are also immigrant responsive. And one great approach that we've had is working with the Township of North Huron to help them develop Cricket Day for a group of immigrants from Southeast Asia. And that has just kind of blown up. And so now there's tournaments held twice a year, and it continues to grow. So if you're interested in learning more, our website is here, huroncounty.ca, immigration-partnership, or you can email me at home@Huron County. Thanks so much.
Thank you so much, Mark, for sharing all those insights, kind of building off of that. I was wondering, Mark, if you wanted to share one specific example from Welcoming Week that might highlight an instance of successful community engagement and really creating that welcoming atmosphere.
Yeah, I think these events held at the libraries, and they were really coordinated by the local library branch managers. They invited people to come to the library, meet their neighbor, and there were representatives from various community groups in town to say, hey, here's what we do. Here's how you can join us. And are you interested in volunteering? Or there were also local elected leaders who were there as well to welcome people. So those were really important to create new connections between newcomers, existing organizations, and people who care.
Thank you so much. And kind of directing it back to Dr. Saleema, I saw one of the questions in the chat I would love to direct to you. For language barriers, how does virtual electronic translators fit into addressing a step towards increased comfort, accessible, kind of looking at virtual access, if you talked anything about the telehealth aspect?
Yeah, I think that's a wonderful idea. And virtual or electronic translators are, a good a good way to ensure that we have effective translation services, given the fact that, I mean, of course, the human aspect of translation is good, but given the fact that we don't have enough, translators available at a given time in all of the healthcare settings, therefore, I think electronic translators are really a good way to at least ensure that the crux of the message is communicated well between the immigrant patients and the healthcare providers. So yeah, thank you for that idea.
And then this is kind of back to Mark. If a person wanted to become more involved in efforts to welcome immigrants into their community, what would be the best step beyond emailing Mark? I know you mentioned Welcome Week and how you got a bunch of community organizations together there. And I know you have a website. Like, how do we get into like different ways to really reach out to help connect immigrants, or how immigrants can get involved in their community?
Well, I think the first step is just seeing what action you can take personally. So one of them is like it starts by showing that you're welcoming and accepting and you value people. So smiling at people on the street or saying hi. We're in small towns and it's not uncommon for strangers to say hi to one another. You know, having a little chat, just these first steps to building bridges. I hear lovely, lovely stories about immigrants moving into communities and their neighbors go and buy them coffee, or they show up with a plate of cookies. And so these are the things that make people feel like, wow, I'm in the right place. I made the right decision to move here. Those are the first steps. And then take a look around and read in local media about what's happening to support immigrants. This weekend, for instance, there's a Diwali festival that the Indian population in Wingham has welcomed the community to join them. So it is a ticketed event, but there's all kinds of little events for people to get involved in being a welcomer in the community.
Thank you. And this is a bit on a different note, but back to Dr. Saleema. You talked a lot about brain health and heart health and all the different types of health that immigrants might have differently compared to the Canadian population. But I was wondering, what's the key to improve cardiovascular health of immigrants?
Yeah, that's an interesting question, Sage. And so, when it comes to cardiovascular disease, a lot of the risk factors are really lifestyle related risk factors, right? So, for instance, the diet that the patient consumes, the amount of physical activity that they do. So that is all sort of, that contributes to cardiovascular disease. Now, as I mentioned in my presentation, that many of the immigrant communities being belonging to different cultures, they have very different kind of, health related practices. So, their diet may be different, their practices around physical activity are different. And so therefore, the key to manage cardiovascular disease well, the first thing is to understand their unique risk factors. What kind of diet are they consuming? How much physical activity are they doing in? That kind of exploration. And then the other level is the self-management and the family caregiving bit that I talked about as part of my presentation as well. Because once they are diagnosed with a cardiovascular disease, a big part of the care, apart from the clinical care that the doctors and the nurses would provide, a big part is really the self-management and the family caregiving. And so to guide them appropriately, to increase their health literacy around that, I think that would be the key for managing cardiovascular disease as well among this population.
Thank you. And this is one last question that I will direct to both of you. What role does education play in making welcoming communities? Dr. Saleema, if you want to talk about as the role of an educator, and maybe Mark, you want to talk a little about why you wanted to put together this presentation in the first place and your continuing in webinars.
Yeah, for sure. Mark, would you like to go first or? Okay, I'll go first. Okay, so yeah, I think that's a wonderful question, Sage, and I think education does play a huge role. Education and awareness, both. And I think, I mean, of course, as an educator myself, the student populations that we deal with, we try our best to sensitize them to the unique needs of the many different vulnerable populations, not only the immigrant populations, but also the indigenous populations, the gender diverse populations, women, all of these populations who have been disadvantaged in terms of their health over the years. We try and propagate that awareness and that education among our students who are healthcare professional, who are going to be healthcare professionals soon, right? Who are going to be nurses, who are going to be physicians. And I think that's a great way to do it, because these healthcare professionals are gonna make the healthcare more inclusive and equitable in future for immigrants and for the other vulnerable populations. But also, as I was listening to Mark, he was sharing some really good points around the general public and how to just generally make our public and our communities more welcoming. And I think that kind of awareness is also very important. And I'll hand it over to Mark now.
Thank you. I think you're right. It is so important that we learn, and it's if you are only exposed to uh, certain information and you don't get other perspectives, then you're just stuck where you are. So education is the key to expanding our horizons and making sure that people have better understanding of the different experiences that people have and how we might be able to address them. I think it was important when we got the results from the immigrant survey that we went, wait a minute, do people have enough information about what the challenges are? Does the healthcare sector know about the challenges that we're being told about that people are facing? And then secondly, does the public know that this group is being really challenged by this? We hear it in our community all the time. Oh, well, you know what? It's so hard to get a family doctor. And I think for newcomers, we don't hear that as frequently, but I wanted to really make sure that it was emphasized and that we could better understand what are the barriers, what is keeping people away from seeking care. And I think Saleema does such a great job of highlighting why that is. So hats off to you, Saleema.
Thank you. And now, as we conclude, it's coming up on the hour. We hope that this lecture has proved educational and insightful into immigrant healthcare, understanding and addressing barriers. Thank you so much, Dr. Saleema Allana and Mark, for presenting. I have learned an incredible amount, both on the individual health impacts, on migrants' experience of healthcare systems, some fun facts, maybe not so fun as well, about their health, and also about what role the municipality may play. If anyone is interested in this topic further, the Huron County, as we said, Immigration Partnership is an excellent resource and provides a network of connections to immigrant organizations in the area. Gateway would also like to thank our sponsors. Without them, the lecture series would not be possible. So McGee Motors, Hurontel, DeJaegars Pharmacy, CIBC Wealth Management, Libro Credit Union, and Tuckersmith Communications. So Gateway is a not-for-profit organization with charitable status, and we greatly appreciate and welcome any support at all we receive. Gateway is excited to announce our next upcoming lecture, where we'll be changing gears and talking about individual health management and more on the rehabilitation side. Our topic is occupational therapy, physiotherapy, and speech language pathology in rural regions, where we're going to invite a local physiotherapist, Dagny Hawes, an occupational therapist, Kathleen DeHagen, and a speech language pathologist who works in remote communities, Lauren Summers. And we really once again, want to thank all of you, to our panels, sponsors, and especially you, our audience, for tuning in. I'll see you next time. Everyone have a good day.
Thank you. Thanks for having me. Thank you. Bye-bye.